With the outbreak of COVID-19, blood banks are no longer allowed to organize physical camps or any large public event. You can't just go out and donate blood the way you used to. And as a result of that, many blood banks across the country are facing an acute shortage of blood units. And especially at a time like this, when there's a health crisis, blood needs to flow to those who need it the most. With social distancing becoming the new norm, people are likely to be more skeptical about participating in blood donation camps the way we understood them, or even events which blood banks organize in the future. Well, as this lockdown eases hopefully across the country, the requirement for blood, you can be sure, is only going to increase further. The incremental demand is likely to come from elective surgeries, which were earlier deferred due to the lockdown, and other cases of accidents, trauma, which reduced due to lack of physical movement. As a result, blood banks are now looking at new and innovative technical solutions which can help them reach out to potential donors in their communities and encourage them for voluntary blood donation. Facebook, with its 40 million plus registered donors, is uniquely positioned at this time to help fill this gap with its blood donation. And India today is partnering in the Safe Blood Saves Lives campaign in partnership with Facebook to raise awareness about how, even during and after this pandemic, blood needs to flow to those who need it the most. Today, the 14th of June, is World Blood Donor Day. But as the world battles coronavirus, blood banks are running dry. India today is focusing on how India can deal with this problem. So step forward, volunteer, and donate.
Blood donation gives a new lease of life. The blood donated by us saves many lives. To create awareness about blood donation around the world and make it simpler, Facebook has created a blood donation tool. Through this tool, not only have 4.5 crore people in India become aware of blood donation, but they have also registered themselves as a blood donor on Facebook. Now, hundreds of registered blood banks in India are associating with these blood donors to effectively fight the problem of shortage of blood donation. Let us see how we too can join this campaign by facing to your Facebook account, search for blood donation in the search bar on top. In the next screen, below Facebook Shortcuts heading, click on the blood donations link. Then click on the Sign Up button. Now in this new window, click on Sign Up again for confirmation. That's it. Now you have been registered as a blood donor on Facebook. Whenever a blood bank in your area will be in need of blood, you will get the information through a notification or through a news feed post. Besides this, you can go to the blood donation hub and see the requirements posted by the blood banks near. Click on the suitable option. You can contact the blood bank and then reach there at the assigned time to donate blood. Come, let us all work together to ensure regular and safe blood supply. This step towards blood donation can save many lives.
And please remember, viewer, this definitely involves you, and it can involve someone you love going forward. So I'd like everyone to pay attention to this extremely important message, because safe blood does indeed save lives. And that's why we're taking the occasion of World Donor Day to tell you how, despite this pandemic, despite your anxieties about donating blood, it doesn't need to stop, and it should not stop, because between technology and arrangements out there, there are ways for this crucial blood to continue to flow to those who need it the most. Joining me live now to give us an expert perspective on how this network, supported by Facebook and put out there to facilitate the flow of blood even during and after the pandemic, we have with us Rohit Kumar Singh, Additional Chief Secretary Health of the Government of Rajasthan, which has tapped into Facebook's network, Dr. Zareen Bharucha, Chairperson of the Federation of Bombay Blood Banks and Head of the Department of Transfusion Medicine at the Tata Memorial Hospital in Mumbai. We also have with us Chetan Gowda, who's a founder of Khoon Khas and Kunal Arora, who is a thalassemia patient based in Moradabad in Uttar Pradesh, who has had to travel to Delhi quite frequently for blood transfusions. Kunal, I want to start with you, and I welcome all my guests on this particular show. The requirement for blood never ever stops for those who need it the most. It has been a source of anxiety for patients like yourselves, especially during the pandemic, about whether blood will be accessible, whether there will be any interruptions. Take us through your experience and tell us how you've been able to access blood and how Facebook's technology has allowed you to always have access to blood.
And it was diagnosed when I was 3 months old. So all the doctors told that you have to do bone marrow, blood test, and many more. So we live in Moradabad, and then we have to go to Sarangaram in Delhi. After each and every week or a month, they call us for many blood samples, and it was diagnosed when I was 4 months old. So from then to now, I am taking blood transfusions after each and every 15 to 18 days. So when I was small, then my weight and age was less, so I have to take less unit of blood. And now my age and height is increased, so I have to take more blood units. Now I take blood transfusion in every 15 to 18 days. So I collect my blood from Indian Red Cross Society, and I take 2 units of blood on each and every blood transfusion. And
yes,
there is many more diseases, side effects, and many more difficulties to face after this thalassemia major when it was diagnosed. So it was very tough to manage and all the things. So now I am an international player also of table tennis. I won 2 national gold medals and 1 bronze medal. So I do not allow my problems to overcome on my strength. So
you know, Kunal, that is incredible. What you've basically told us is that there were anxieties about whether blood could be accessed, but the tools that have been made available right now have allowed you to have an uninterrupted supply of blood, which you need every 18 to 20 days. Chetan Gowda, I want to come to you now. You run Khoon Khas, which has organized blood donation camps, at least the way we understood what blood donation camps were in the past. Everything has changed now. People are anxious about going out there and donating blood the way they used to. Can you tell us about how you are mobilizing people using Facebook's tool, to continue the blood supply? Are you getting enough blood? How useful is this? How are you making it happen?
Shiv, due to the pandemic, all blood banks across the country are facing an acute shortage of blood. None of the previous activities we used to do are working out because most camps are cancelled or postponed. So that's when we started onboarding blood banks to the Facebook tool so that they can make use of the tool to reach out to people using Facebook nearby to their blood bank. So over the last 2 months, we have mobilized more than 3,000 donors across the country. And I would like to share that mainly blood is required for thalassemia and blood cancer patients. They need transfusions every 15 days. And due to the pandemic, it's become very hard to find donors. And currently, we are serving to almost 100 to 150 thalassemic patients in Bangalore, Delhi, and Mumbai. And every time we have made use of the Facebook tool to be able to reach out to donors. And we have had a very positive response. So donors are interested, but I just feel that it's a lack of communication between the blood banks and the donors, and the way we do awareness is what is lacking right now.
Yes. No, there's an incredibly vibrant blood donation community in this country that's been affected by the lockdown. But what Facebook's tool basically tells you is that nothing needs to be interrupted. Blood banks, the country, all across the country are facing an acute shortage. But if, as Chetan Gowda says, communication can happen, awareness can be raised like through this show about the possibility of uninterrupted blood supply. If you'd like to donate blood, there are ways you can do it. Everyone is on Facebook, so there is a way you can register and get your blood out. Before I go to Rohit Kumar Singh and Dr. Bharucha, I want to tell you, we've put the spotlight on how you can be a blood donor. Nothing needs to stop that. Let's zoom out just a little bit and see how this technology is used to help deal with this problem of blood banks running dry. During the coronavirus pandemic, it may not be easy for you to step out to donate. That's totally natural. People are anxious. That's where India Today and Facebook come to your aid. Here's how you do it.
The dawn of 2020 brought with it the first case of COVID-19 in India, a global pandemic which is yet to find a cure and continues to spread. As social distancing and restrained gatherings become the new norm, shortage of safe blood is one of the most pressing challenges that India is being faced with. In the absence of the traditional blood camps to mobilize voluntary blood donations, blood banks are now facing an acute shortage.
The number of non-COVID patients in hospitals has actually come down. We are facing an increasing demand for blood on our platform, and that's probably because blood banks are running low, as there haven't been blood donation camps in a long time now.
To ease this crisis, Facebook's blood donation feature can prove to be an effective tool. Facebook has trained blood banks across 16 states, and 9 of these states have given out directives to use Facebook's tool to mobilize donors for voluntary blood donation. In this critical time of COVID-19, it is important for everyone to understand the urgent need for blood. And many donors across the country are doing their bit to reach out to those in need.
I saw a tweet from Blood Donors India for urgent requirement at Indira Gandhi Hospital. I called up on the number to check if the requirement is fulfilled, but the patient's mother said that nobody has turned up because COVID-19 patients are in Indira Gandhi Hospital. And I went to hospital and donated my blood.
It was for the first time I was donating platelets, so I was a bit scared, and that too at this time of this pandemic. But when I reached the hospital, the process of the platelet donation was completed very seamlessly there. So overall the experience was very good, and I felt really joyous on donating the blood, donating the platelets, and be a part in saving someone's life.
Every few seconds, someone somewhere needs a blood transfusion to save their life. And 1 pint of blood can save up to 3 human lives. So this World Blood Donor Day, let us find our sense of purpose by signing up as a voluntary blood donor and saving lives.
And what we want to tell you is this isn't something that's just being proposed. This is something that's been proven already. Facebook's tool is already being used by thousands across the country, and the blood is actually flowing. We've shown you a patient who has benefited from this blood supply. We've introduced you to Chetan Gowda, who is mobilizing for this. Now let me bring you the bigger picture to show you how, on a larger scale, technological tools like Facebook's are really helping blood banks fill up. Dr. Bharucha, coming to you first. You've been able to facilitate the adoption of Facebook's blood donation tool by all private blood banks in Mumbai. Can you tell us how that experience has been, ma'am? Given the many constraints the city has been facing during the pandemic.
Actually, I would say that in India, there's not much altruism for blood donation. People don't come forward to donate blood as they do not realize that it is the community responsibility to keep the blood banks full. We cannot have the we cannot have the patient waiting for blood, and we need to have the blood waiting for the patients. And that is what is important, which people are not realizing. They feel that they will donate only when they or their own relatives and friends require the blood, which is really not true.
Yeah.
And that is the requirement of for us to go to the people through Facebook or any other IEC materials or social media, to go to people to make them understand that it is their responsibility and they should see to it that they donate regularly so that all patients get the blood. We in Bombay have nearly 59 blood banks, out of which nearly 50 are our members of the Federation of Bombay Blood Banks. And of course, during these months when the colleges and schools are closed and people go out of Bombay for their vacations, we do every year have a shortage. But this year, because of the COVID, the shortage is more acute. People do not, they are afraid of coming to the blood banks, especially the blood banks which are situated within the hospitals. They don't want to go there and donate
I can imagine.
blood. Yeah. And therefore, they do like to donate blood somewhere like in a standalone blood bank, which is not in a hospital. We do have a few standalone blood banks in Bombay, especially the Red Cross, where I chair the Red Cross committee also. And we can say that transfusion requirement goes all the time round the year. The thalassemia patients are there, which require their transfusions round the year. At least some people require every week or every 15 days at least. And they need blood. And for that, we request everybody to please come and donate blood at the blood bank. Or there are many donor organizers and organizations who organize blood camps. And at the camps also, blood is being collected. And now with COVID...
you've made... So Dr. Bharucha, I just wanted to pick up on one of the points you made about, we are not an altruistic country as far as blood donation is concerned, and blood donation should be a community effort. I'm also wondering whether, the ease that technology brings in, and this tool by Facebook, perhaps it will actually stir a greater impulse for donation. I'm not sure about that, but I wonder if that could be the case. Before I come back to one of those points that you made, Dr. Bharucha, I also want to bring in Rohit Kumar Singh, who's the additional Chief Secretary in charge of health in the government of Rajasthan. Mr. Singh, we do know that Facebook has, just a couple of days ago announced a tie-up with the Maharashtra government. Rajasthan, and you're part of that effort, has already proven the usefulness of this particular tie-up with Facebook's tool to access blood. Tell us about that experience, Mr. Singh.
Oh, I think it has been a wonderful partnership with Facebook. Just to give you the magnitude of the problem here, we have about 155 blood banks, out of which 93 are private and charitable, and the remaining 62 are part of the government, both central and state government. And we also have 128 storage units.
Right.
When the corona crisis descended on us, we saw a fall in the units being collected. And as Dr. Bharucha was right in saying that, patient should get blood as per the demand. And we saw that we used to collect 40,000 units before corona. And this dropped to 23,000 in March and 16,000 in April. We were very alarmed because the requirement of non-COVID patients for blood, for many things, continues to be there, and we have to address that. So then we partnered with Facebook, and we wrote on 6th of April to all of our district medical officers that you will have to do this to publicize this. Then we are very thankful to Facebook. They trained all our people online on 10th of April. Then all the blood banks got registered on Facebook, requests were generated, and now it's a very seamless kind of a process where the request for blood and within the 5 kilometer radius, it goes to all the users of Facebook, and it's been It's been a
Yes.
fruitful experience. I'll just give you the number for May. We are back to 41,000 units, what we were collecting in December. So it has been a great partnership.
Incredible.
And today is World Blood Donors Day, and we having 200 camps. We will, in half an hour, know how many units we collected. So I think this partnership has really inspired to get back.
That is incredible. I mean, Mr. Singh, you've given us real numbers by a state government that has embraced this particular tool and actually put it into action with blood banks in the state to meet an immediate need during a difficult time, which is the COVID crisis. We all know that the requirement for blood is going to go up and the unpredictability factor is weighing on everyone's mind. So this tool has actually solved that problem, which is incredible. I also want to take some questions. Since I'm privileged enough to be joined by the four of you right now, we've also invited some questions in which we're receiving live, via Facebook. I'd like to take some of those questions because these are people who are tuning in, remember, and wondering about how, since you spoke about altruism, Dr. Bharucha, these are people perhaps who are looking at certain hurdles and wondering if their questions are answered. They'd like to tap into this tool and go out and become blood donors as well. Swarnim Bhatia has a question where he asks, if I am asymptomatic and I donate blood to someone, will that person also be affected by coronavirus? A difficult question, Dr. Bharucha. Is there an answer to that question about asymptomatic persons going out and donating blood?
You mean he is infected and asymptomatic? Is that so? That means, but
yes.
Now there are so many patients being treated with such COVID plasma. So the patients who are infected with COVID and then they become asymptomatic later on, or they are treated well and all that.
Right.
After 28 days of that, their tests are done again, and if they are negative, their plasma, which contains the antibodies, can be used as a treatment for moderately ill patients of COVID. And there have been cases where these patients have recovered very well from the plasma treatment. Of course, there are cases where it has not helped. But ICMR is doing a proper clinical trials at the moment, and we'll soon come to know what is the report and whether it is really going to help us in future.
Okay, so that answers that question. We're being flooded with questions, and I'm very happy to report that there are a lot of people tuning in, and obviously a lot of interest in recognizing this tool, opening up a pathway to blood donation. So I think that's an excellent sign. It's time for me to slip into a very short break. When we come back, I'm going to list out some of those questions, and I have a few of my own, and we will take this forward. People are plugging in. Safe blood saves lives. We're going to tell you how you can contribute. Thank you for staying with this special broadcast here on India Today, where we're putting the focus on Safe Blood Saves Lives on World Donor Day. We're putting the spotlight on the Facebook tool that allows you to donate blood despite the pandemic. We know that blood donation isn't what it used to be. People are anxious about going out and donating blood, and this is a country that doesn't donate blood enough as a community effort anyway. But here, live on television, we're showing you how it's actionable and it's working as a result of these available technological tools. All our guests continue to remain with us. I want to take some more questions because these are real people asking real questions about blood donation. Ankit Purushottam Dikshit has this question. How is online blood donation different from manual blood donation, and how does the process of online blood donation actually work? We've got graphics on our screen that tells you how it actually works, but I'd like to bring Chetan in because he runs Khoon Khas, which actually oversees some of these networks that have tapped into Facebook's tool. Chetan, for a person asking that basic question, how is blood donation through the Facebook tool different from blood donation previously? How would you answer that?
The best part of online blood donation is you can reach out to them virtually. You can send them notifications, remind them about an requirement which is not possible physically. And irrespective of the kind of awareness we do physically, if you want to donate blood after 3 months or 6 months down the line, if you're not a regular donor, you'd forget the awareness session you had attended. But wherein in case of Facebook for blood donations too, we have had that privilege and opportunity to send out notifications whenever there is a requirement. We have been working with around more than 60 blood banks in Karnataka who have been actively using the Facebook for blood donations tool over the last 1 year. And even today, to give an example, in spite of COVID cases rising in Karnataka, we have been able to organize more camps, and all of these were posted on Facebook. So we have had 200 plus donors who turned up seeing on Facebook to the blood donation campsite.
That's amazing.
So that's the kind of impact.
That's incredible.
Yes. So,
Chetan, since this is a Facebook tool and everyone is familiar with Facebook and the architecture of notifications, getting notifications, this is something that can, easily fit into the lives we're already used to. And that's one of the great things. As Dr. Bharucha said, the patient should never be waiting for the blood should be waiting for the patient. Let me go on to our next question. Chetan, I'll come back to you and you can, add to that as well. Roma Das asks us, what are the measures one should take before considering donating blood online? Dr. Bharucha, are there things that need to be considered? Is there a checklist that people need to, sort of tick off in their minds before they consider donating blood through Facebook's tool?
Actually, there are criteria for selection of blood donors, and there are medical history is asked of the patient, and those forms, if they are put on the Facebook, people can realize whether who can donate and who cannot donate. I have actually not seen that very well, so I don't know whether all those things are included. And if they are included, possibly it will be very easy. Actually, what happened is that Facebook, it was initiated in Bombay just prior to pandemic. We were busy with our Indian Conference of Transfusion Medicine the month of February, and by March we got the training for all the blood of how to use the Facebook. And immediately after that, unfortunately, the situation has started. So we have not been able to do much about. But I think we can improve on, because there is a need for social media to make people understand. And now that people started using social media, previously people were not using social media. Now people have started using, and so they will read it and they will understand who can donate, who cannot donate, and where to donate, which are the blood banks which are close to their house or office where they can go and donate, or which are the outdoor camps being organized during that week or during those next 2 weeks.
No, it's incredible because some of those questions, the beauty of this technology is it answers some of those questions now, and it can be tailored as the learnings increase to answer even more of those questions, like what a person needs to do if they have a particular condition. Now, Adil Ikram has a question that I actually personally also had and wanted to ask, which is, if I am a normal healthy person and I wish to donate blood, what if I have some disease which hasn't been diagnosed so far? What procedure will I have to follow before donating blood in a safe manner? Because I'm obviously also thinking about the safety of that donation to a recipient patient. Chetan, is there an answer to that question?
Yes, sir. So as soon as you visit a blood bank to donate blood, you're made to fill a questionnaire which talks about your health condition. If you are not aware of it, there is also an oral screening which happens with the social worker present at the blood bank or with the doctor.
Yes.
So apart from this, even then, if your answer is no to all health issues, and if you feel that you're an eligible donor, And if your blood pressure and hemoglobin levels are good, and if you're not diagnosed, then after donation, the blood is sent for testing. So in India, there are two types of testing done. One is ELISA testing and the other one is NAT testing. So these tests are basically done to find out whether the donor is HIV, HABs, and other types of viruses, whether the donor is positive to them. So as soon as if the donor turns out to be positive, then there is a different procedure wherein the donor will be contacted and the counseling will be done for the same. So the transfusion takes place after all tests are being done. So it's completely safe for the patient.
Okay, so that's a definitive answer, which is good. So that answers Adil's question. The next question is one that I hope Mr. Rohit Kumar Singh will be able to answer, because I'm very impressed with the level of questions we're getting, because people are also thinking ahead within the context of the pandemic, the COVID-19 pandemic. Meghna Verma has written in to ask, are you working with people? When she says you, I imagine that she means, people who are plugged into this network, Mr. Singh, but you can take that question if you want. Are you working with people who have battled COVID-19 to collect plasma? You've talked about how you've been able to tap into this network to get blood to those who need it. What about collecting plasma? Can this network be used for that?
So we've still not used this network to collect plasma, but two of my hospitals in Jaipur are authorized by ICMR, and I'll go back to the answer given by Dr. Parucha. It is still in the stage of clinical trial, and the plasma that we got from COVID-positive patients who had turned negative was used in some very severe patients, and we had good results. In fact, one 72-year-old doctor got cured through drug therapy. But I'm repeating it again, it's still in the process of clinical trial. And before we make bigger use of it, we would wait for ICMR's approval of the trials.
Absolutely. So any concrete steps need to be taken with the approval of the ICMR. Theoretically, it's possible, but it can only happen after trials actually happen. The technology exists. The way it can be scaled to, get plasma is theoretically possible, but it can only and strictly only happen with ICMR guidelines. Piyush Pandey has another question. Again, a question that I had in my list, but, clearly all of us are thinking alike in terms of getting our doubts answered here. Piyush Pandey asks, can someone get coronavirus by a blood transfusion? What happens if a person tests positive after donating that blood? Dr. Parucha?
So far as we know, it has been said that blood transfusion cannot transmit the COVID infection because no tests are also available for that. But so far, whatever I have read in scientific journals, it says that it cannot be transmitted through blood transfusion.
Right. Okay, so it can't happen through blood transfusion, so that answers that question.
No.
The very basic personal anxiety that people have about blood donation, they may have had it before anyway. Now it has, of course, been exponentially amplified as a result of the the coronavirus scare. Meghna Verma asks, is it safe to donate blood right now? It's not the same sort of blood bank that you're donating in. There are standalone places where you can donate blood as well. Is it safe? How do you address that anxiety, Chetan, for people who are still worried about going somewhere, possible contact, even with all the restrictions and safety measures?
So I would like to share my experience in Karnataka. We have been closely working with the Karnataka State AIDS Prevention Society during the pandemic. So we have made sure that all blood banks are being sanitized regularly. There is availability of masks and sanitizers at the entrance itself for donors. And to add on to your previous question, whether it is safe, I would also like to add that we are also collecting an exclusion letter, which asks them about their travel history, whether their contacts or anybody who has been in touch with them have turned out to be COVID positive, and a government ID detail. So these details are being shared with the State Blood Transfusion Council, just in case if somebody turns out to be positive after donation, that blood bag could be deferred for transfusion. So apart from this, even at blood banks, all blood donation chairs, all blood donation beds, even the equipments which are being used for blood collection are being cleaned after every donation. The blood banks are functioning with 50% staff to avoid overcrowding. All donations are happening on an appointment basis. No more than 3 people are allowed inside the blood bank at a particular time. So this is how it's been happening in Karnataka. And I would like to share that this is the right time for you to come out and donate blood if you are not in a containment zone, because we are facing an acute shortage. And if you don't come out now, then it will cause a huge problem for patients who are dependent on these blood transfusions every month.
Yeah. No, the 2 points that I want to stress even further, and I'm glad you said that this is a good time to come out and donate, and it's important that people come out to donate, is A, that the safety factor exists, things are safe at the moment, and above that, what Dr. Bharucha had talked about, that we need to, no matter what, we need to tell ourselves that blood donation needs to be a community effort. It's a community responsibility. It's not supposed to be an emotional thing. This is human health. Tomorrow, today somebody needs blood. Tomorrow, you or one of your loved ones will need blood, and you will be hoping that that community responsibility had kicked in earlier. That's what this is about, because blood donation truly involves us all. Kunal, since you use the Facebook network to get the blood that you need every 18 to 20 days, I want to ask, how difficult would it have been, Kunal, if this tool did not exist? This tool gives you a certain measure of predictability in getting the blood that you cannot do without. How difficult would it have been without such a tool?
It was very difficult when the blood banks were empty. So we have to find in blood banks so that they can provide us paxil blood. We, the thalassemia patients, need paxil blood. So the separation machines are not available in every city or state. So we have to go to Delhi and find out in which blood bank blood units are available. So if blood units are not available, so we call them before 1 or 2 days before getting our blood transfusion done. So they tell us about the shortage of blood. So we arrange a donor, or we contact some non-profit NGO like Sarthak Prayas on Facebook. I use Facebook tool like I need a blood 2 units of B positive. So they provided me that 2 units, or they provided me a donor so that I can take my blood transfusion on time. So they helped me very much. And I would like to thank all the donors, those who have donated blood and gave life to us. So thanks to all of them. And please come out to donate blood in future also.
Very well said. Very well said, Kunal. I think, a thank you to all donors and an appeal to all, potential donors who are watching this show and hearing about this tool also deserve our thanks in advance, because the time is now, like Chetan said, to come out and donate. It's very heartening to hear that there is a certain predictability to those who need blood receiving it. There is a comfort, in technology. There is a comfort in an app. There is a certain predictability that apps like this actually give us. And Facebook's tool really fixes that gap and provides a certain amount of predictability in terms of receiving blood. Mr. Singh, I want to ask you this, because there will be an end to this pandemic. I hope it is sooner rather than later. And once that happens, the requirement for blood is likely to spike. Are you and your teams cognizant of that? I mean, I'm not saying you're not. I'm sure you are. But with the tools that you have right now, are you confident that you will be able to scale and utilize these tools to meet that big spike in blood demand, sir?
Oh, absolutely. Not only for blood donation, for all other non-COVID healthcare related issues, We are totally aware. We are focusing on that. We know that COVID is here to stay, although in Rajasthan it's flattening. But we are totally focused on what will happen after the pandemic, especially in terms of blood requirement. And we have done a small innovation, which I would like to state here, and so that other states can also do. We don't want people to wait for larger camps. If 6-7 people are in a housing society and they want to donate blood, we send our mobile vans and collect blood from there. So people, don't need to get scared of coming to a hospital and the fear of getting infected. So we said, no, we are sending the van there, and you 6-7 people stay there, and we'll collect the blood and come back. That has really worked. We got this inspiration from our mobile OPD vans idea. So Rajasthan deploys 550 mobile vans in curfew areas, containment zones, and other zones because public transport was restricted, and we provide OPD services and free medicine services. So we got that idea that why not take this to their doorstep and get the blood collected. That has really worked.
Incredible. So the anxieties that people have is also being addressed by some of these measures. Don't wait for the large camps. The requirement is now because the acute shortage is now, and every drop matters at this time. It's not about a deferred availability. Dr. Bharucha, how do you see this tool meeting that large demand that we're expecting to see happen during the waning period of this pandemic, when the requirement for blood suddenly goes up?
I think we'll have to have some kind of pledge forms for people to fill so that they may be called as required. And there will have to be some registries to be formed of various blood groups, especially the rare blood group that is Rh negative, which is required so often. And also the Bombay group, which is once in a while required, but the donors are not available. And from one end of the country to the other end of the country, we have to send that blood when it is necessary. So that kind of registries will have to be started, and Facebook will be able to help us in that, I'm sure. To have the pledge forms for donors and to have the registries of various kinds. Even the bone marrow donor registries, which are already there, can also be helped by the Facebook. By, they will have to have little more awareness through the Facebook of all these requirements, and at the same time have forms of various types to be filled in, so that we have the registry ready to call the donors immediately as and when required.
Okay, very interesting. Chetan, how are you ramping up and preparing for this higher requirement? The appeal is there that the tools necessary for safe donation exist through Facebook. You don't need to wait. It's very easy. You just need to, follow the instructions that we have on our screen, and you can donate blood very, very safely. But what about, what Mr. Singh and Dr. Bharucha have been speaking about, where the requirement suddenly spikes after the pandemic? How is Khoon Khas? How are your teams preparing to mobilize in a bigger way?
So one I'd like to mention is we have launched a toll-free helpline, national helpline on 24th of March. So this is operational across India. And what we have been doing is we have been using Facebook and other social media platforms to promote the helpline so that willing donors can call us and register. So through the toll-free, we have mobilized, we have saved around 11,000 lives since 24th March to till date. Today alone, we have received around 1,300 calls in a single day. And on top of this, even if the requirement spikes, I think having 4 crore people register on a single registry or a database is a huge thing in a country like India. And reaching out to these 4 crore people at your fingertips through your mobile device is something amazing. And we have that with us, and with the right way, with the right motive, we can make use of the Facebook tool and all the other organizations which have their helpline numbers and a couple of other initiatives to meet the demand which is going to be there post-lockdown. And another thing I would like to specifically mention is due to the lockdown, we have seen an increase in walk-in donations at blood banks. even though people are scared to come out and donate blood, as all blood donation camps were cancelled, there are people who have come down and donated at the blood bank. And this percentage of people who have come down and donated at the blood bank has been higher than regular times. So if you take Karnataka, 95% of collection happens at blood donation camps, and only 5% happens at blood banks through walk-in donations. And now, with the help of Facebook too, we have been able to increase that, so that it becomes a responsibility for the donor that he or she should not wait for a blood donation camp to take place and can walk into a nearest blood bank to their place and donate every 3 months. So, as this.
So my final question. My final question before I close this, it's wonderful to hear that there is that measure of predictability and a kind of incentive, to get the blood when it's required the most. Mr. Singh, I'd like to end with you because, you're in a government that's implementing this and seeing it on the ground. My final question before I thank all of you is the old way of blood donation now going to be a thing of the past, sir? The pandemic is never going to go away fully. We're going to live with COVID-19. Tomorrow there may be, God forbid, another, disease we have to deal with. Is this new form of blood donation going to be the model standard going forward?
I think so, absolutely. And I would like to add another point that, this is a classic case of how good public-private partnerships work. And we're talking just blood donation, and I'm sure this could be an example for greater public-private partnerships in other dimensions of public health care. So I think it's a great example, and it's very inspiring. And we will follow it up with other domains of healthcare as to how to leverage private sector efficiencies and capital and other things.
I think this is a great note to end on. We've established the success of the model. We've told you how to use the tool, and we've given you a live example, not just of beneficiaries, but those who are facilitating and using this tool for this all-important, most indispensable aspect of healthcare all around the world, and especially here in the country. Safe blood saves lives, and we here at India Today will continue to bring you the latest on this crucial issue. Thank you very much, Rohit Kumar Singh, Dr. Zareen Bharucha, Chetan Gowda and Kunal Arora for joining us on this special broadcast.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.